So thank you all for joining us today for episode 20, Access to Information at the Midland Metropolitan University Hospital. So this episode is dedicated just to the Midland Metro University Hospital. This has been a long thing waiting for, and as you will hear in the podcast, that yes, it has gone pear-shaped, and you might hear that a fair few times, but we don't look at that, and we're looking into the positives. So today, as everybody knows, we work alongside the Sandwell and West Birmingham's NHS Hospitals Trust. This is all to bring access to information to the community, all things health, and to let them know about this new, beautiful, state-of-the-art complex that is being built for the Sandwell and Birmingham areas. So let's start off, let's go straight into it and listen directly to the passion, the commitment from the Chief Executive himself, Toby Lewis.
So we're just with Vocal Rogue. We're here at the Midland Metropolitan University Hospital with Chief Executive Toby Lewis, and we just want to get some wording about him and some information. Yes, we've had all the bad things that have happened with it and it's all fell down, but we're not looking at that. We're looking about moving and building it forward. Yes, these things have happened in life, but we have to move forward and we have to get this all sorted for our communities that are in desperate need of this uprated and upgraded state-of-the-art complex. So we'd like to ask Toby today, Toby, we know that it's gone a bit pear-shaped down the line. We don't look at that. We don't look at things like we deal with positivity here. So now that it's back online, when are we going to expect it to be done by?
Yeah, it'll be done by the summer of 2022. And as you say, this is a once-in-a-generation opportunity, isn't it? So we've waited too long, but our job now is to make it absolutely fantastic for the communities that we're part of and that we serve.
So how do you feel about this project? I know that it's been a little bit long-winded and there's ups and downs, but there's ups and downs in life with everything, as we know, Toby. And how do you feel? Because we feel here at Vocal Rogue to give it to the community that we feel absolutely happy that it's happening, and it's about time. Yes, things happen, like we said, but we're not going to look into that. We're looking into the positives.
So I'm thrilled because what I see is the enthusiasm of our nurses and our doctors. I see we've got 1,000 volunteers working on the project. We've got people who are going to bring community gardens and community planting onto the site. The excitement of people who are involved in the biggest art gallery that any hospital's got in the West Midlands. Those kind of collaborations into our community, they're what gets me really thrilled about what this development can deliver for people over the next decade or two.
And that is absolutely brilliant. So we'd like to also ask, with this being opened, we're going to have so much unity, as we like to call it here. So we're going to have gardens, we're going to have things. So what can the public expect when the hospital opens?
Well, I think what people can expect is that this is a spacious, airy environment where if your loved one is in our hospital, you'll be able to visit them. There'll be facilities for you to be with us all day. There'll be refreshments, there'll be music, there'll be art. And that's not a nice to have, that's part of healthcare. Because if you're trying to get better, or you need to get better, then the environment you're being cared for in is important to you, and it's important to the staff who are looking after you as well, isn't it? So you can expect that.
Yes.
I think the second thing you can expect is a hospital that really wants to work with the local community. So we're investing in community projects, we're investing in voluntary projects, we're working with researchers in the community around these parts. We're working with the Canals and Rivers Trust, for example, to try and develop how this hospital sits within this place. So we don't want to be a hospital on a hill. What we want to be is rooted and grounded in the communities of Ladywood, Perry Bar, and across the towns of Sandwell.
And we'd like to say thank you for today, Toby, because this is a big thing. Yes, we said everything's gone pear-shaped, but we would just like you also to give the last bit of what you believe for the community that's going to bring them on board for everybody to work together.
So look, if you have kids in schools round here, what you should be hearing today is there is a university hospital in your midst, and we want your children to be the nurses, doctors and scientists of the future. That's what this is about. This is about transforming life chances. That is success for the Midland Metropolitan University Hospital.
Thank you very much for your time, Toby. This will be up later on Sunday. Thank you very much for your time, and we hope to see you soon. Thank you.
So thank you for Toby for giving us this remarkable feedback of what is going on. You know, at Vocal Rogue, we're so excited, and we should believe everybody else from West Birmingham all the way through to Sandwells. you know, this is for the community. They're bringing in, look, universities they've brought on side to find the next scientists, the next consultants, the next chief executives. This is what needs to be done for a smarter, brighter future. So what we're going to do then now, let's go in and listen to Dr. Nick Makwana.
So as we're saying today, we're here at the Metro Midlands University Hospital that has been rechanged, and we're here with Nick Makwana. And Nick Makwana, can you tell them what you do as a job, please?
So I'm a consultant paediatrician, but I'm also the group director for women and child health, so I look after maternity services and gynae services as well.
Absolutely brilliant. So I know it's been a bit long-winded, everything's gone pear-shaped, and it's now brought back on track. So we don't watch what's going on in negativity, we deal with positivity, and this is getting this thing open, and it's going to be open for 2022. So I want to hear about you and what you feel about this project and what the public can expect.
This project for me is truly amazing. I started my first job as a house officer in Dudley Road Hospital, now City Hospital, and coming right out this other end to seeing a new hospital being regenerated into the area is a real bit of an emotional roller coaster for me. It's emotional. I feel really proud. I feel proud of the staff that have worked really hard to get the services working, because we were delayed, obviously, getting into our new building. So I'm proud of them whilst they're redeveloping services and pathways fit for purpose into the new building. So I'm really proud of the fact that we're getting a new research facility there, and that the patients that come in will be able to actually benefit from local research and be involved in local research, which will improve outcomes from others, not just for them. So that's really amazing for me. Being part of the university, having 4 universities come together under the title of a university hospital is just absolutely awesome. You know, I've worked with students for a long time, and what I'm really looking forward to is working with different kinds of students, bring them together in simulations, making them work together, because we know that the only way that the NHS is going to move forward is working together as teams. And that's not just teams of doctors, but teams of multi-professionals. So for me, that's really amazing. And I think the final thing is the community part of it. You know, I was talking earlier about the bricks and mortar part, but actually what for me is really exciting is the aspirational part. What I want is people to walk past this hospital and say, I want to work there, how do I get in?
And that's what we definitely want, because we've had, you know, like police and so forth, and people didn't want to do this. But like we said at Volcarog, we're all about bringing the community together, because we need to do this now. Time has changed. We're from an older generation ourselves, but we need to bring it forward. So thank you very much for today, Nick. We're really, really proud of you. We're really proud of this hospital, and it's all about this public have got something for themselves.
Thank you very much.
Thank you very much for your time. Bye-bye.
No problem.
So there you go, people. You heard it direct from Dr. Nick Makwana. 4 universities on side, which is absolutely fantastic. Students are going to be there. They're working with all sectors. NHS is working with people. This is good news for the area. Brings more jobs, brings more prospects, and most of all, brings the community together. So we're not going to just stop here. We're going to go straight in and let them say all for themselves. We're going to now listen to Ruth Wilkins, the Director of Communications for this Trust Volunteering Service.
So we're here with Ruth Wilkins, Director of Communications, and she works with the voluntary sector and getting people worked in. They don't just do voluntarily, they actually give you help and move you forward, and they are a very, very big support line. But I'm not going to say that. I'm going to get Ruth to say it all, because she's more know-how. She's a really, really nice person, really lovable.
Thank you. I'm really delighted to talk a bit about our volunteering service. It's a fantastic asset for the Trust. We have currently 555 volunteers supporting.
That is absolutely brilliant.
Supporting a range of different services. So some of the work that they do is they come on, they help staff, they help patients get moving if they're in hospital, and that enables them to make sure that they don't get stuck in a bed, and that can often mean that people's muscles deteriorate, and it takes a long time for them to get back. And so what our volunteers can do in some of these projects is help people who are already mobile to make sure that they keep walking a bit and moving around, so that they don't get to the stage where they've got to rebuild up all of that muscle strength. So that's one of the projects that we do. And then we have all sorts of other roles. So we have people that can befriend people who are lonely or need some help. They might need some assistance working out what's out in their community that they can, when they go back home from hospital, they can get in touch with. We've got volunteers that help with bereavement, with end-of-life care, with people who've got alcohol problems, so a whole range of things that volunteers can get involved with.
And how would they be able to get through to you?
Okay, so all you need to do is look at the Trust website, which is swbh.nhs.uk, and put volunteers in the search, and then you'll come up with a page that tells you all about volunteering and how to apply.
Seriously, that's absolutely brilliant. Like we said, just go into the SWBH NHS Trust, which we're on also. You'll find us on there, and you will find more than a hospital also on there, and you'll find out all the information to get through to volunteering, because we know there's a lot of you out there. You have contacted us at Volker Oak, and we're directing you to the places that you need to go to by giving you the full access to information for wherever you need to go through. You ain't got to wait around pressing all these buttons on the internet. One click takes them direct to them. So what else do you do for the community? What could they expect when they come to you?
The volunteers,
Yes.
so there's loads of things. So what we're trying to do is develop some partnerships with local community centres so that there's a really easy route into volunteering, and that can sometimes mean that someone comes to volunteer within the trust, but we can actually then place them in a community centre or a community service or a voluntary organisation that needs some help as well. So we're trying to set up those sort of two-way partnerships. So if there are volunteers who want some experience of working in a hospital, they can come and volunteer for us, but we might have volunteers that really want to support their local communities, and again we're really happy to help people find their right niche.
So basically, you're basically breaking down walls.
Yeah, I hope so, and I hope we're building up really good relationships between people who volunteer in the hospitals, staff who work there, and patients who come and use the facilities. We want to use volunteering as a route to kind of bridge some of that. Coming into hospitals is a frightening experience, and people can be scared, they don't know what to expect, and they're worried about their own health. So the support of volunteers can really help people through that journey and help with their healthcare and their treatment at the end of the day.
And that's what it's all about. It's about well-being and self-care, and we have to start looking out for each other, start coming together as a community, because it gets people to the places a lot more quicker than rather having brick walls, breaking down brick walls. So thank you very much for your time,
Thank
Ruth,
you.
and hopefully we get to see you soon, because I just want to let you know you do have to come on and do a full podcast as well with us. Okay, thank you very much for your time.
Thank you.
Thank you. So like we said, we're at the Birmingham Hospital, which people now know as the Midland Metro University Hospital. We're here with the Sapphire Services, and we're talking to
Veronica.
So Veronica, can you just let the community know of the West Midlands and globally all around the world of the work that you do for the community?
Okay, basically we're part of an organisation called the West Bromwich African Caribbean Resource Centre. The Sapphire Service is a project, and we are with an organisation called Age Well, and we also work with an organisation called Kingfisher Buddies, and Kingfisher Buddies, that they work with people that are living with dementia. Age Well, they kind of deal with patients of all ethnics. We do as well if referrals come through, but if we don't get referrals come through, we actually target African Caribbean patients in the hospital. If they're Sandwell patients, we arrange home visits for them when they go home and see what kind of support that they need in the home, and we don't just support the patients, we also support the carers as well, because
Because they're suffering as well. Carers
Yeah,
are suffering
they
as well
are,
as
yeah.
the sufferer.
Yeah. So the project was only supposed to last for 2 years. We won an award last year because the work is being so successful. And we've really supported a lot of patients in the hospital and at home when they've gone home. There's some of the patients that their living conditions weren't really too great. They were too big for them, because, like say, their partners, their wives and husbands had passed away. So a few of our patients that I've been working with are in smaller accommodation now, where it's warm, it's comfortable.
They feel like they feel like somebody again.
Yes, and we also, and once we've kind of got them settled at home, we try to get them back out into the community to give them a better quality of life.
Yeah.
And we've also, some of our patients actually attend our daycare centre now at the West Bromwich African Caribbean
And would that be
Resource
okay
Centre.
if we could send people towards you, because we got big resources.
Most definitely.
And it's the West Bromwich Caribbean Centre, is
Yeah,
it? Is
West-
that the one run by Shane?
Yes, yes.
Well, when you go back home, go to Shane and say, Ruggs says to say hello. Ruggs is the one that painted your hobby, your hallway, your lobby, and your kitchen.
Wonderful.
Do you remember when that got done?
Yeah.
That was actually me.
Okay.
Okay? So we will definitely be in contact, and we will give it more exposure, because we've got a lot of work to give to Shane, who we have to meet up with closely in the next couple of weeks. Is that okay with you?
Can I just introduce
Yeah,
the rest of my
introduce the
team?
rest of the team.
This is Hayley.
Hello, say hello, Hayley.
Hello,
Tell us a bit about what you do as well, Hayley, please.
I'm a support worker at the Sandwell, well, based at the West Bromwich African Caribbean Centre, but we work in the Sandwell Hospital, Rowley and Russell Hall Hospital, and we approach African Caribbeans and see if they need any additional support once they get discharged from hospital. And yeah, that's it, just to reduce their admissions to the hospital, for them to stay at home so they can have a better quality of life.
Yeah, so we're getting all out to the community and giving that community spirit and bringing back that community vibe, because we do believe that is what's needed. We do believe, from the youngsters to the elders, we have got the notion between us to get this all done. And with Volcarog, we're all to work with the community. We all expose people's stuff, what they do, so the community has got all this access to information at hand in one place. So we will be getting back with you, because we will be getting you on to do a podcast for your own, because we are all global and we want to hear everybody hear about you. So could I say hello to you as well in the back, please?
Hello, my name is Jean.
And how are you today?
I'm alright, I'm fine, thank you.
Thank you. And could you tell them a bit more?
No, I'm a support worker and I do the daycare on a Monday and Wednesday, and I do safari.
And how do you feel when you get through to the people and you're doing the daycare centre? How do you feel that they react and work with yourselves?
They will okay, and they feel alright, and they feel good, and they work with us.
And that's what's needed, like we says, in the area. So we're going to get over to the final lady in the room, as we like to say. And if I could get your name, please, also.
Etna, trainee, second week with the company.
Second week? Oh, so you're kind of young and fresh, as we like to say.
That's right.
Oh, that's brilliant, but it's all about bringing new people in, and it's all of us working together, as we know, within cultures, as bringing together. So how do you find yourself at this new place now? How are you, I know it's only 2 weeks, so asking questions is a big thing, but how are you feeling there? How have they welcomed you?
Great, wonderful. Settling very well.
Settling very well. And what did you used to do before this?
Housewife.
Housewife, absolutely brilliant. This is what it is. We want the housewives them to get out there. They are human beings as well. They're not supposed to be stuck behind no cooker and nothing. They're supposed to be out there helping with everybody also, because it's all about together, and we believe in women's lib also here at Volcarog. So thank you very much, everybody, for your time. Say hi to Shane for me and say Ruggs, and he'll know who you are.
Okay, you can also find us on the website.
And tell them your website, please.
West Bromwich African Caribbean Resource Centre.
Thank you very much for that.
At www.
Did you like that, people? Did you like that, listeners? This is what we like. We like to have a laugh. We like to have a joke. We like to be serious, because life is serious sometimes, but you have to have a laugh and a joke, because if you don't, it just drags you down.
I'd also like to big up Mr. Desker Howe. He is our daycare manager. He's the manager over all the wellbeing division. And this is basically kind of like, say, his project, really.
His little baby, as I like to call him.
Yeah. He started off as a volunteer many years ago, and he's actually the main manager now over the whole of the daycare centre, and he started off as a volunteer as well.
See all these good news. They start off a volunteer and they keep moving and progressing in life. This is absolutely brilliant. Please tell him to look us up on Twitter or on Instagram or any of our sites, or go on to www.volcarog.com. Tell him to send us a message, and we can get back inside and do something together for the community.
Can I just say, if you would like to volunteer for the Sapphire service, get down to the West Bromwich African Caribbean Centre and speak to Desker Howe.
There you go. You heard that firsthand. So don't forget, all you volunteers out there that we are with, and other charities that we are working with, so Headway and a lot of others, and Kaleidoscopes and everybody, we are going to be moving together to work as one, so we can get more out to the people and out to the masses out there that do really need this, desperate for the help and for the support line.
So there you heard it, straight live and direct from Sapphire Services over there in West Bromwich. But they was not just the only people along there. There was also the Real Junk Food Project over there in Birmingham. Go check them out. Also was the Sick Be Nourished that helps out in other communities around the world. Go and check them out. They're doing such great things, these people are. Also there was Energy. They're the Clean Air Pollution Project. Go and check them out because they can tell you all about your carbon footprint and so forth. We'd like to thank everybody for today because this has just been dedicated to the Midland Metropolitan University Hospital. We're so glad that this is actually taken off board now to give us access to information, to health, to new jobs, to a vibrant and more smarter and brighter future. Look, they're working with 4 universities. They've got, we'd have to say, a big shout out also to their staff, which do amazing things. So you will hear more of them in their own individual podcasts in the coming months. So please tune in and check us out on our volcarog.com page to find out all the information. And like we would like to say is a big thank you to Sandwell and West Birmingham NHS Trusts, who we work alongside. Thank you very much for giving us this opportunity. And you can catch us next time on Vocal Rogue, where we will bring more access to information and more news to what's going on in your community. Thank you.